When your mental health care calls for a prescription, you want to ensure you're seeing the best professional possible to manage your medication. In this session, Dr. Dom explains the types of mental health prescribers, the types of training they undergo, and how you can ensure your doctor is well equipped to help you succeed. Now let's talk about those that can prescribe drugs. We have a psychiatrist, which is what you are. So who are you? What is that?
So let's talk about psychiatry for a minute. So psychiatry is a medical subspecialty, as we said, right? So a medical subspecialty very similar to the medical subspecialty of cardiology, right? Or an allergy doc or gastroenterologist, or a nephrologist or a neurologist, right? So there's all medical subspecialties. So a medical doctor. Now medical doctors in the United States and even abroad fall under two categories. You have MD, and you might see the letters DO. Now I fall under the category of DO. When you're applying to medical schools, the two degrees that are fully licensed medical physicians are MD and DO. The difference only being that DOs also study musculoskeletal medicine in their undergraduate medical education. So when people see the letters DO after a person's name, it's a fully accredited medical doctor, but they studied some musculoskeletal medicine as well. But the residency training is the same, the testing is the same, the board certification is the same as MD and DO, so that's all the same.
So is a DO higher than an MD?
No, I wouldn't say higher. I'd say the philosophy, the undergraduate philosophy is different. So I purposely chose DO as opposed to MD, and I got into both schools, but I chose DO because at the time I wanted to be a family doctor, and DOs are kind of known for their sort of holistic, well-rounded family doc kind of vibe. So, and I wanted to learn musculoskeletal medicine at the time because I was into fitness and training and things like that. So DO was a nice fit for me. So I'm a DO, but I'm a fully licensed medical doctor, and I trained in my residency right alongside MDs, and as a matter of fact, my residency training program was an MD training program.
So if someone's looking at a psychiatrist and they've narrowed it down to a DO and an MD, they would choose the DO if they were looking for someone who had a background in that more holistic viewpoint of health.
Yeah, I would say that, but again, I mean, this is like philosophy of schooling. So unfortunately, and I wish I could say differently, I think a lot of the DO philosophy sort of gets lost once you get into residency, and then there's like a minimal distinction. But I think people choose DO because they start out at least with that holistic kind of vibe, you know?
Got it. So really at the end of the day, a psychiatrist.
You got it.
Okay, all right. So now what about a mental health nurse practitioner?
Okay, mental health nurse practitioner. So now you have a nurse, right, who went on for additional training, which is some pretty rigorous training, and can be either at the master's level or even at the doctorate level, where they become a nurse practitioner or an APN, and they can prescribe medicines. And
what's an APN?
An APN, what does it stand for? It's a nurse practitioner. I'm not sure what it stands for, though. That's a great question. We gotta look that up.
Yeah.
But these are individuals that are fully licensed to prescribe medicines. And in a lot of states, they can independently prescribe medicines where they don't need an MD or DO supervision. So this really works out well in a lot of cases for states that have a low demographic of prescribers where it's really, really necessary, especially in behavioral health. So I know a lot of APN and nurse practitioner NP prescribers in New Jersey as well as multiple states, and they're great.
So an NP can see patients, talk to them, implement CBT type of therapies, and then prescribe them medication.
Yeah, so they go through their nursing training, right, and their degree, but then they usually do extended training in psychiatric nurse practitioner training and certification. So
the difference between a psychiatrist and a nurse practitioner is just the amount of schooling that the psychiatrist has had.
Yeah, I mean, so a psychiatrist really, and unfortunately, it just took a long time, right? And so a psychiatrist, if you think about it, is 6 years after medical school, right? So you have 4 years of medical school plus 4 to 6 years of additional training. I mean, time-wise, is certainly not as intensive being a nurse practitioner, but still, focusing on psychopharmacology and maybe some therapeutic interventions. Some nurse practitioners are great.
Okay,
really good.
What is psychopharmacology?
Oh, psychopharmacology. So now you can actually get into the field of the doctorate level pharmacologist, right? These are pharmacists that have what's called a PharmD, right? This is all these degrees, right? But a PharmD is a doctor of pharmacology. So there again are certain areas where a pharmacologist with a doctorate degree can prescribe. So when you say psychopharmacologist, again, we're talking about a broad term because I know psychiatrists that consider themselves psychopharmacologists. And basically,
You're hurting my brain here.
I know, I'm sorry, I don't want to, I'm going to clear this up.
Yes, I know you will.
So psychopharmacology is basically the study of psychiatric medicines, right? So a psychiatrist like myself, I like to do a lot of things. I like to do therapy. I love CBT. I've studied CBT. I've studied interpersonal psychotherapy in my residency. I consider myself a good psychopharmacologist because I have a very good background in psychopharmacology training as well, right? But some psychiatrists might say, I'm a psychopharmacologist. And that's almost like saying, I just prescribe medicines. I don't deal with the psychotherapy part of the behavioral health field.
This is people really need to get this because I've seen a lot of therapists and psychiatrists. I have worked with a psychologist going through CBT or DBT in conjunction with a psychiatrist who I see every 3 months for 10 minutes, and he just asked me about my meds and that was it. And then I've also seen a psychiatrist who prescribes me meds but also works with me through CBT. So all psychopharmacologists have to be psychiatrists, but not all psychiatrists are necessarily psychopharmacologists.
Ooh, I think it's the other way.
I
think it's also this is like some logic here that you're hurting my brain, right?
I just got to get it.
I think all psychiatrists by default, because of their medical training and pharmacology training, are all psychopharmacologists.
Okay.
Right? A pharmacologist with a doctorate degree is also a psychopharmacologist.
Right, and not necessarily a psychiatrist.
Exactly.
Got it.
Exactly, because a psychopharmacologist that's a pharmacologist or a pharmacist really just understands medicine and that's it.
The psychiatric pharmacist is another name for a psychopharmacologist.
This is a pharmacist that really specializes in psychiatric medicines.
Okay.
And in certain instances can prescribe.
So I have had mixed feelings personally on whether it's better to see a psychiatrist and a psychologist or an all-in-one psychiatrist who also does therapy and talk therapy. What are your opinions on that?
Yeah, so this is so varied because it depends on so many things. Now, for example, I did psychiatric residency at New Jersey Medical School, right? And my program, I chose that program, and I was lucky enough to get in. I chose that program because it was very heavily weighted in psychotherapy. So my entire third year of residency training, because there were 4 years of residency, the third year was just intensive psychotherapy training, and I loved that.
No medication,
we still worked in the clinic, we still covered the ER, we still did all of that, and we learned a lot about that. But my third year was very focused on understanding all of the psychotherapeutic interventions and seeing patients and having a supervisor, and right? Some residency programs in psychiatry, they cover the basics of psychotherapy, but they might be heavily weighted in the psychopharmacology part, right? So it kind of depends where you do your training and also what you resonate with and what you like to do, right? I could just as easily have graduated my residency program and said, you know what? I just like to manage medicines, so I'm not going to do any therapy. So Kyle, if you come to see me, listen, I'm going to write your prescription. I'm very good at understanding what medicines work and don't work and what are going to be good for you and diagnosing. But you got to go see someone else for therapy. I could have just as easily been that person. So it really depends on who you see. And I know that's vague. In a perfect world, honestly, I think that a psychologist that trains in a special field of therapy, meaning, let's just use CBT for example. In my private practice, I'll share this with you, I know a handful of psychologists that are so good at CBT and one that's really good at DBT and literally like top of their field with research and experience in those fields, that my patients, I'll say, listen, we have a great relationship and I do a little bit of therapy with you, but I'm going to prescribe your medicines and I want you to see this person for cognitive behavioral therapy once a week. right? So I'll make that recommendation.
Even though you do cognitive behavioral therapy.
Right, because but that's all they do.
Right, I get that.
And that's just different. If you really want the best for your patients, I think that's, in my opinion, that's a really nice mix. So, you'll have a prescriber like myself, and then you'll have someone that really digs in with the psychotherapy.
I personally think right now in my life, I like a one-stop shop. It's easier.
Yeah.
They know the meds I'm on. They get the meds. They understand talk therapy. I'm with them every time. I don't have to have this managing my psychiatrist, managing my psychologist. That's just my little thing.
But let me say something else, though. Unfortunately, we're talking about a lot of options. But in reality, and I think the viewers are going to agree with me on this, sometimes those options aren't available.
Oh,
right?
Amen to that. Right.
You're lucky that you can say, you know what, I could have a therapist if I want, but my psychiatrist is kind of doing it all for me, so this is perfect. In a lot of cases, people don't have that choice, right? Like they have to find a therapist, and there are no psychiatrists in the area that are doing therapy. They're just doing medication management, so it really depends on where you are.
Any other prescribers that we're not mentioning?
No, I think, so we have the medical doctors, the MDs and the DOs, we have the nurse practitioners, the APNs, and we have some psychologists and some pharmacologists that can prescribe. I think we hit it.
We also have primary care physicians.
Primary care physicians, that's an important point. Oh my God, I can't believe I forgot to say that, because here's a statistic for you. More psychiatric medicines are prescribed by primary care physicians than psychiatrists.
Okay.
That's pretty wild, right?
That's wild, and I understand there's a shortage, but that is also alarming to me. Because most of me feels like, I don't know if that's the way it should be. I feel like the mental health people need to do the mental health people, and
Well, I think that statistic is slightly misleading, because there are a lot more primary care doctors than there are psychiatrists right off the bat.
Right.
And we're probably talking about like antidepressants and some of the more intro medicines. So I think that's why that statistic is so significant. And there are some really, really staggering numbers too, that in the entire United States, there are only 8,000 board certified child psychiatrists. Imagine that, the entire US, 8,000 board certified medical child psychiatrists. So you can see the shortage where, if you're in the middle of the country in some rural area, you're going to see your pediatrician for psychiatric medicines in that case, because you're not going to find a child psychiatrist.
Now, we talk a lot about these board certifications. You are double board certified. It sounds very impressive, but what does that mean?
Okay, well, it's really not that interesting. Well, maybe it is, I don't know. So in order to be board certified, and I can speak to psychiatry because that's obviously what I do, in order to be board certified, you have to attend medical school, you have to graduate medical school successfully, and then you have to attend a accredited residency program. So you have to do the full 4 years in psychiatry, finish it, complete it, do all of the requirements, then take a national board exam. And the national board exam is, the psychiatric board exam that everyone takes. You have to pass that, and then you get board certified. And basically, that's a credibility thing. It's saying that if you see Dr. Sportelli, there's a standard that he passed, and if you see that plaque on the wall, you know that he went to med school, he went to residency, he finished it successfully, he took the tests, and he's complying. And also, in order to remain board certified, every year you have to do a certain amount of what's called continuing medical education. And then every 10 years, you take the big exam over again.
Oh, wow.
Yeah, so if someone has a plaque on their wall that says board certified in a medical subspecialty or a medical specialty, it's just an accreditation. It's saying, okay, they have the training, I can feel a little comfortable with this, right?
But if they are a practicing psychiatrist who is not board certified, that doesn't mean they didn't graduate school. It just means they didn't take that test or pass it.
It could mean a lot of things, right? It could mean that they took the board certification exam and just didn't pass it. It could mean that they didn't re-up their board certification. Sometimes it lapses and they decide for whatever reason, I'm not going to take the test.
Got it.
Now in my case, when you say double board certified, it sounds really cool, right? But what happens is, so I did general psychiatry. I took that exam and I did all the training for it. And I'm board certified in general adult psychiatry, but I went on with another 2 years of child and adolescent training, which has its own set of rules and its own accreditation body. So there's a whole other, process of exams and, testing and fellowship requirements, and then you get double board certified. So I have 2 board certifications.
How many boards are there?
So there's a board in just about any medical subspecialty you could think of. The thing is, though, that they're very time consuming, right? Like if I wanted to be a cardiologist all of a sudden, I'd have to go back to residency and start over and do, 3 or 4 years of postgraduate medical training.
Don't do that. We like you.
No, I wouldn't do it.
You're perfect the way you are. Just stay like that. Okay, well, there are even more types of providers to cover, and we're going to get to those in our next session.